screen looking okay?
Yeah, it's looking fine. Just can I'm not able to see the bottom half, so I'm not. It's fine, Priya. The voice, Payal couldn't hear you. Couldn't have a voice. Okay, bye. Dr. Puri.
Can you just check the height, the light and everything?
Yeah. It's looking, can you just speak a little bit?
Yeah. So today is the 7th of the month, November. We are in the 10th month of the corona pandemic. Okay.
That sounds good.
Lighting okay?
I think good. All fine.
You can hear me?
Yeah. Just say a few words if you like.
Hello sir, hello Sapna, all the very best.
All the best.
आपके पास कितने questions आ गए?
All questions आए हैं sir.
I'm quite sure that quite a lot of them will be kind of common.
Yeah, I think we need to go on mute. We need to go on mute. I think the team's telling us to be on mute. All right.
Welcome to yet another exciting webinar through ManipalCigna, through our holistic infectious disease management program, WeCare. I welcome you all. Our goal at ManipalCigna through the WeCare program is to arm you with the relevant information and knowledge that will help you fight the growing tide of infectious disease. India is facing a triple disease burden, the non-communicable disease, infectious disease, and of course the reproductive disease that is existing. With this backdrop, COVID has upended our entire world. It has clearly redefined in the way we are living in today's world. Having said that, we are nothing less than at a war. As the book says, The Art of War, one of the principles of the battle strategy is know thy enemy than ever before, right? So this is very, very relevant in today's aging time. One of the most vulnerable part of our body is the respiratory system. Unfortunately, breathing and lung function are things that we take for granted unless one gets really sick and understands the importance of really keeping the respiratory health very, very well up and running, and complete immunity is really very, very important. Having said that, with COVID being on the rise, it has direct implications on our respiratory health. And it's relevant in today's aging time with COVID being there to have knowledge and information. Thus, today's webinar is extremely special and incredible for all of us, because our guest today is not only a powerhouse of knowledge and information about the respiratory diseases and their control, but also a reputed radio and television commentator. He is an Indian sports journalist and broadcaster. He conducted popular quiz for Doordarshan for almost 18 years. His experience spans across four decades in the field of upper respiratory tract. He is Emeritus consultant of ENT and Head and Neck Surgery with Fortis Healthcare. He's also acting as an advisor of medical operations with them, and works in the capacity of advisor to FICCI, ex-chairman of NABH. So it's a great pleasure and great honor for us to welcome Dr. Narottam Puri today as a guest speaker. Welcome, sir, and we look forward to a very engaging and interesting session today. So I request you to share your views, sir, around COVID and generally around respiratory disease control.
Well, thank you very much, Priya. Thank you, ManipalCigna, for hosting this seminar at a time when respiratory diseases actually peak in India. It is also a time when we are seeing a huge number of patients all across the globe suffering from what was essentially considered just a respiratory disease, but today we recognize it as much more. That is the COVID-19. Therefore, it's very, very important for us to understand some of the do's and don'ts of respiratory diseases at a time when pollens, pollution, COVID, asthmas, allergies, everything combines along with the cooling temperatures to create a situation that is often harmful to the human body. So from the perspective of this particular epidemic, it's important to realize that we are learning every day about it. Around about 60,000 papers have been published already, and approximately 220 scientific papers are being published per day on this subject. And what we are now understanding is what started off what appearing like just a flu-like virus is far more than what we imagined it to be. And therefore, we are no longer calling it just a respiratory virus, but it is primarily a respiratory virus, which also produces a lot of other organ damages. It is from the coronavirus family. There are 7 coronaviruses which produce human diseases. 4 of them just produce flu-like symptoms. 1 produces what is known as Middle East Respiratory Syndrome, MRS, and the other, we all are familiar with the SARS epidemic that affected all of us. This is a slight variation to the SARS virus, this coronavirus. This is the beta version, and it tends to be more important from the perspective that whilst SARS used to only be able to transmit itself from an infected person who was suffering from symptoms, this particular virus can be transmitted in asymptomatic phase. Therefore, you don't know from where or from whom you are likely to get an infection. The other important thing is that it was around about the 10th of January, I think, that the first case was reported by China in Wuhan. On the 30th of January, the first case was reported in Kerala, in India. And now in India, we have approximately 84 lakh people who have suffered from coronavirus. And sadly, 1.25 lakh have lost their lives to it. Therefore, this is not a respiratory disease that we can take very easily. And therefore, I compliment you for focusing the attention of everyone on this disease in particular. But let me once again repeat that this is not a disease that is only respiratory. It's actually a syndrome which can affect many organs. In fact, a lot of people are now calling it a syndemic. Reason being, there is a social element to the epidemic. The epidemic was declared in March by WHO, but since then, it has spread all across the world. But there are certain strange things with this virus which we are still learning. And one of the things is that for a 1.5 billion population in Africa, there are very few cases reported from there. And if you were to look at India, you will find that the most populous states, Bihar and UP, have far less number of cases than some of the other states. Why? We still don't know. There are theories, of course, but we still don't know. And we only hope and pray that both Africa, UP, Bihar, etc., will not fall prey to this particular syndrome going forward. The other end of the spectrum is the rapidity with which research has occurred in this particular disease. In my 52-year-old career as a doctor, I have never ever seen, heard, or read about the rapidity with which we have approached this virus, identified it, known what it can cause, what is the likely treatment of this particular disease. We've learned in months. And remarkably, we have reached a stage within a year where a vaccine will be found. Now, normally it takes about 10 years before a vaccine gets released. But here the rapidity of research is remarkable. So whilst we salute all our corona warriors, doctors, nurses, healthcare workers, and the allied forces that support them, we must also remember to salute the scientists who work behind the scenes in giving us the tests that by which we can detect these diseases and possibly a vaccine that will come very soon. From the perspective of the world, it has never ever in the last 100 years suffered from what we can say is a stark choice between life and livelihood. And that has created a major problem for governments all across the globe, affected the economy, and caused a huge loss of hard capital. And this is bound to keep on affecting us because this virus is not just going to go away. Therefore, along with the rights that we enjoy, we must remember the responsibilities that accrue to us and take care not just of ourselves and our immediate neighborhood, but also of the entire community and the humanity.
Sure, sir, and very rightly said. It's a greatest example of how humanity and science have come together to the rescue of all of us. I must say, today's format, sir, of today's webinar is all about people sending in questions. So when we had requested our viewers, our customers, all our partners, and all the people who have logged in today through registration, to send in their requests and send in their questions ahead of the session so that we can really take on the general questions and top of the mind questions that are really bothering them. So we've got some questions ahead of the session, and we will also be to all the viewers, I request that as and when you have any question, please feel free to drop it into the comments and the question Q&A section. We'll be opening the floor for an exclusive question and answer round with Dr. Puri in a while. So, sir, can I, request you to please throw some light? And you've kind of touched upon it as to how many publications are there across the world, what's happening, what's the kind of, balance between livelihood and, kind of lives, so to say. But what's the global outlook and arena? What is happening around the economy? Measures that have been taken across different countries, and what are the measures that have failed, and what are the measures that have worked, and what are the best practices or success stories that we can really touch upon very broadly?
I think what we have learned is that if you want to control this pandemic, you need to control this not at the hospital level, but at an individual and a community level. The second
Right.
thing that we have learned over the years, or over the months really, is that the only way to control this is by aggressive testing, tracking, tracing, and then either treatment or isolation. Lockdown is a form of an isolation, and that's at a level of the entire community, whereas isolation may be for an individual who's suffering from it. The, the point is that lockdowns are being criticized because they affect the livelihood. And to an extent, that is true. But the proof of the functional improvements that occur following a lockdown are evident all over. And as you all know, that Europe currently is undergoing a lockdown again of a different nature. Now, we've learned over the months how to do a lockdown, what is the degree of lockdown that is required. So there may be micro, there may be one particular community, a particular type of service that may be stopped, but the rest may follow. So there is a lot of learning that is occurring on almost on a daily basis. The same is true as far as testing is concerned. We didn't have a test to find out whether this can work or this we can diagnose or not, although we knew that this is a coronavirus on the 7th of January itself. And the second thing is that along with the testing, you've reached a stage where now the specificity and the sensitivity of a test is increasing, and the time taken to give a result is decreasing. Therefore, the diagnosis of a case of COVID as separated from other diseases is far more rapid, far more surer than it used to be a few months ago. Last but not the least is that since we have learned that this is a virus that affects many parts of the body, we have started treating the people who requires hospitalization in a very different way. Earlier, it was a hit and trial because we didn't know what will work, what will not work. Today, we understand much more. We still do not have a drug that can kill this virus, but we do have drugs which can help support you live longer and survive the acuteness of the episode. What is the important thing at the present moment from the hospital perspective and from the government perspective is to reduce the number of fatalities. The
Right.
second thing depends as much on the government, as much on the community, as much on the individual, and that is to protect yourself. We have also learned that till such time that a vaccine actually comes, mask is the new vaccine. So if you mask up, you're likely to have the same effect as a vaccine. Let me tell you, Priya, you have to understand that mask is now a part and parcel of your apparel. You've got to wear it just like you wear a shirt or your pants or any other clothing that you wear daily. This is not going to go away for the next year or so. Therefore, a mask is something that you need to understand to wear properly. A proper mask worn properly, having a social distance of 6 feet, and washing your hands. These three, if you were to do, and everyone to do, will make sure that the spread of this disease is controlled. And one last thing, a vaccine is no panacea. When you have a respiratory virus like a coronavirus, vaccines don't have 100% effect. So if you do have a vaccine which works, and we will soon know whether it works or not, then the maximum that you can expect this to be efficiently working and providing you with some immunity is around about 60-70%. This is the learning after 20 years of experience with the influenza vaccine. And
Right.
even in the influenza vaccine, what happens is that you may still get influenza despite the vaccine, but the severity is reduced.
Correct.
Therefore, I expect that the vaccine, as and when it does come and is effective and safe, it is not going to give 100% coverage, and it's not going to just uh, say, okay, guys, now you can take off your masks and you can start having your parties. That's not going to happen at least for a year.
Yeah, long gone are the days, and absolutely valid. It is important for us to understand that this is part and parcel, an integral part of our lives on a go forward basis. So absolutely valid.
That but
So,
true.
yeah, yeah, absolutely. So, sir, Dr. Puri, we've got multiple questions. These are generic in category and genre. Some people have asked us as to, now this time of the season is a winter setting in. We have certain parts of the country where smog issues start, to surface. Given all that, in the past, one would generally have cold and fever and, generic body ache kind of symptoms and some bit of fatigue and all of that as flu. Now, if that be the case, people would just pop in a anti-allergen or maybe an antipyretic and just carry on for the day. But currently, with coronavirus, how do we differentiate between a coronavirus kind of symptoms versus a generic flu and generic fatigue and malaise? How should we kind of differentiate between the two?
Well, it's not easy. Clinically, making a difference between the two is not easy, at least in some cases. But there are certain general pointers that your doctor who is experienced will be able to make a differentiation from one to the other. One is that invariably in the first phase of the coronavirus infection. So coronavirus for first few days may be asymptomatic or it may remain asymptomatic. But from day 5, usually you start getting some symptoms and of the infection having been caught by you. Usually the incubation period is round about 5 days. This is just experience. It can be 1 to 14 days. But just by experience, around 5 days, you start getting some symptoms. And this symptom phase lasts for around about 5-6 days, sometimes 8 or 9 days. And then comes the complications that may occur in the 9th day onwards or 11th day onwards in some cases. But in the early stages, in that first 5-day stages, the symptoms may be very common, like a little bit of a cold, a little bit of sore throat, a little body ache, and slight fever. Usually the fever in these early stages of COVID never goes beyond 100.4. Now, these are some studies which have been published, which indicate that the temperature remains 100.4 or below. Mind you, these are just generalizations. Somebody may have the more fever. The second thing is that the sore throat element symptom in a COVID patient is far more dominant than the nasal symptoms. That is the free-flowing or a blocked stuffy nose, etc. They are less.
Like a rhinitis. Rhinitis in a common flu is a common...
Compared to a flu, which you have sneezing and bouts of fluid running, and then it becomes thicker, and you might have a little bit of a blockage. But those symptoms are less, but throat symptoms are a little more. Fever is around about 100.5, 100.4. The other thing is that in COVID, what happens in many patients is a sudden loss of smell. Now, if that happens, then it is COVID. It's not a flu. Because as you and I both had colds and flus, but the important thing is you may get a temporary transient loss of smell, but you just take a little steam or put some decongestant nose drop, your nose opens and your smell is back. But in COVID, it won't. So that's a huge differentiator. In fact, many people, many clinicians believe that in case your smell suddenly goes, it is COVID and you don't even need an RT-PCR test.
Yeah, in fact, one of our viewers, a couple of them have asked this question. that sudden loss of sense of smell as well as taste and appetite, is this an confirmatory indicator that I have COVID? So I think you've answered that in as many words, that it definitely is a dominant feature, or rather dominant kind of a pattern that we have seen in COVID patients. So that's indeed good to know. And we have some viewers also asking us questions around, if someone in close association, maybe a family member, maybe my driver, or maybe people around me, if I get to know that the person is COVID positive, so should I just rush to get a test done, or what type of test should I do? RT-PCR test, is it confirmatory? There are rapid antigen tests also available today in the market, and there's a lot of work that has happened in India and globally as well. So how should we go about it?
Well, at the present moment, the confirmatory test and the best test to do for COVID is the RT-PCR test. But it depends on many factors whether or not it will give you the true picture. So it is positive in 70 to 80% of cases, depending upon the time or the day on which it has been taken, how it has been collected, and how it has been stored after collection and transported to the right place. So the test requires that it should be taken properly, either from the nose or a combination of nose and the nasopharynx, and then it has to be preserved properly, it has to be transported properly, and it has to be analyzed. So there are certain errors that come in this particular process because it requires a little bit of training to take this sample from the nose and nasopharynx. The second thing is that an RT-PCR test, if it is done, and we have learned this by experience, that if it is done round about days 5 to 7 or 4 to 8, the chances of it being true and more sensitive are far higher than if it were to be done before or after. So it's a test that is the definitive answer to your question, that if the test needs to be done, what should be the test done? But unfortunately, as of now, we can only say that there are certain limitations to this particular test, depending upon the day, the way it is collected, the way it is transported and done. There is the rapid antigen test, or RAT as we call it, but it's about 50% or 60% at best, its sensitivity. Therefore, if you are trying to judge very quickly whether or not the patient has COVID, and in a situation where, let's say, 5 members of the family are affected, and you want to know whether the 6th is affected or not, you can do an RAT, or a community survey you are wanting to do, then you can do an RAT or an antigen test, because the results come quicker. But the definitive answer is only the RT-PCR test. So if symptoms are persistent and the antigen test is negative, you must do an RT-PCR, because you still could be having COVID.
So it gives me a cue.
One other thing, Priya, just to complete the thing, there is a huge development now recently about the RT-PCR type of a test, which can give you a very quick result within hours. In fact, there is a test now which has been approved by US FDA. This has been released in the United States. It might be released in India as well. It is called ID Now. It's by a company called Abbott, and this particular test is somewhat expensive because the machines and everything cost money. But within 5 minutes, if you're COVID positive, you will get an RT-PCR-like test with huge sensitivity. And if you are negative, within 13 minutes, you will know. So
it's a breakthrough then, in that case. It's really a breakthrough.
Yeah. So you must have already read about the test that is called Feluda, which is an Indian test, which is based on CRISPR technology, and you will get a result within 2 hours. And similarly, there is a DNA budge test, which is Oxford has come out with. So a lot of developments are occurring. Not just everybody is just talking about vaccines, but there's a lot of development in rapid testing and more sensitive testing that is coming. And I'm quite sure that very soon you will be able to get a specific and sensitive test, which will give you quick answers within minutes, and you will know whether the person has COVID or not.
Right. So it's a very well-rounded, answer and very specifics, Dr. Puri, and really appreciate it. So net, we are saying that uh, if one person is asymptomatic, probably you not cross that threshold to really do the test. If symptoms are still persisting, then definitely you got to really go ahead and do the RT-PCR. That's the cue that I'm taking from what you just now said. So that's quite helpful. And what do we have to see about this syndrome called as happy hypoxia? So, people are reading quite a lot. There's so much of information around the net. So, tested positive, but my oxygen levels, the saturation levels are continuously normal. When should I rush to a hospital? What is the indication? What is the symptoms are not there. Symptoms are less severe or milder, but oxygen level is still, going down and coming down. So in both of these scenarios, what is your guidance and how do you think people should address or people should handle, and what's the care pathway, so to say, for general public to be aware of?
So, Priya, happy hypoxia means that there is actually hypo means less. So hypoxia means less oxygen. So happy hypoxia means that you are happy, you think that you are fine, but actually you have less oxygen concentration. So the key here is anything below 93 taken properly by a pulse oximeter, by an oximeter, should be taken seriously. Even if you're asymptomatic, but you've been in contact with some COVID patient, or you are having mild symptoms, but your oxygen concentrations are dropping. Now, here it's very important because, again, it depends a lot on the machine that you're using. You must buy a good oximeter. Some oximeters are authenticated and properly calibrated ones. Others are not so good. So therefore, please choose a good brand. The second thing is when you are taking an oxygen concentrate, you must use either the index or the middle finger to use your oximeter on. And if you are having a nail polish, please remove the nail polish. And if your hands are very cold, please warm them. And then just don't rely on one oximeter reading. It has to be a series of readings. And if your normal readings over a course of a couple of days, you find that they are 95, you're fine. But if on the third day, your oxygen concentrator tells you while you're doing it everything right, and the reading falls to 92, it's something to worry about. And therefore, you must consult your physician. And if possible, you should go to a hospital.
Right. So this is quite helpful. And there are scenarios where, symptoms persist, test comes, positive, but the oxygen levels are still in the normal range. So in that case also, these are mild kind of, people infected, but mild symptoms and presentation of COVID-19, symptoms. So in that case also, you're suggesting that we should keep monitoring and follow the guidance from the doctor as to what needs to be done next. That's the understanding.
So here the bottom line is that if you are COVID positive, please remember that deterioration in COVID occurs very suddenly without giving you much warning. And one way of knowing is A, temperature check, B, doing this oxygen concentration measurement. The other is a clinical measure that many clinicians use, and that is called the 6-minute walk test. So if inside your home, you can walk for 6 minutes without getting breathless, probably the lungs are not infected. So these are just general guidelines. These are only to guide you. This is not a definitive thing because it depends a lot on your other conditions. But if you're, let's say, a 60-year and above male patient who's got diabetes, who's a heart patient, and he can't walk 6 minutes, and he has 2 people at home who are COVID positive, I would take that seriously.
Sure. So next question really is, a very interesting pattern of question: myth versus fact, a fact check, and a rapid fire round with you, Dr. Puri. So no fever, tested positive. Is this because COVID-19 SARS-CoV-2 is mutating? Yes or no?
No, not you see, viruses keep mutating from time to time, but this is part and parcel of what COVID is. That it can produce very varying degrees of symptoms. But if the RT-PCR is positive and you don't have too many symptoms, you have to take this as a COVID case.
All right. Routine influenza vaccine seems to provide protection against COVID, and Influvac Tetra effective against COVID-19. Fact or myth?
There is no proof that an influenza vaccine has any effect on COVID. I think part of it stems from the fact that I told you about, because influenza is also caused, there are influenza-like symptoms caused by certain coronaviruses. And this quadrivalent vaccine that is these days available, that is called Tetra, is primarily and mainly for influenza. It is not for COVID. Some people are believing that it may have some effect, but there is no scientific proof. Well, I'd just like to hear, to quote Dr. Tedros, the WHO Director General here, and he made an interesting comment, and he said, misinformation on the coronavirus may be the most contagious thing about it. So, that we are flooded with information which is untested, unscientifically disseminated, and we tend to believe everything that we read on WhatsApp or on Google. So you need to be a little careful.
Absolutely.
Let science determine what is actually happening. But at the same time, I would encourage everyone to take an influenza vaccine.
Right, Dr. Puri. So the next one is, men get often more chances of getting infected with COVID-19 versus what chances we see women who are less prone to COVID-19.
Well, it just proves that the woman is the strongest sex. The fact of the matter is that it is true that men are affected more than women. All the details are not known, but what is known is that if a lady gets a coronavirus, the response, that is the immune response, is led or mediated, as we call it in medical science, by the T cells. And that is more stable and it is more lasting. Whereas in men, the same kind of a response will occur through certain enzymes, cytokines and chemokines, which is not so stable. And that's why you can have a storm, you can have lesser response, etc. But that's just one of the reasons why men are affected more. Definitely there is a preponderance of men suffering from COVID, particularly the serious implications of COVID as compared to women.
Very quickly, lots of interesting questions. One more viewer has asked a question. If I am COVID positive, yeah. So I hope you are able to hear me, sir. The question is, if I'm COVID positive, and would it affect the child if the mother is breastfeeding? So would it affect the child if the person is COVID positive?
Well, that's a very interesting question. There is, again, not much literature available on it. What we do know is that this particular virus is not transmitted through milk. That's point number one. Therefore, it should, in all probability, be safe to continue to breastfeed your child. However, there are WHO guidelines on breastfeeding during a viral epidemic. And there is one paper from UK that I'm aware of, which mentions about breastfeeding if the patient is COVID positive. What I would suggest is that if possible, the milk should be expressed and then given to the child, a little away from the mother. If it is not possible, then all possible precautions should be taken by the mother in terms of the cleanliness, the hygiene, and the mother must wear a mask. But as of now, the information available indicates that COVID virus is not transmitted through milk and therefore should be safe for consumption by the child.
Great. Thank you for that. Now, touching upon the next most important thing, and it plays possibly this plays the most pivotal, kind of role in the way a human being responds to stressful situations, illness, and all other, coping up with anxiety. So, what is your take on mental, health and keeping positive and being, in the face of the current pandemic, with the way it is grievous and it is so aggressive, the way it is spreading, and it has affected not one geography but across the world, and it is kind of impacted economy as well. So, what's your take on the mental health and well-being in the face of the virus?
Yes, I think, Priya, that's a very important element to it. First of all, this virus, because it's a pandemic and it has killed so many people and caused morbidity in others, is something that has instilled a degree of fear in the communities and in human beings. Justified. The second thing is that it has not allowed normal working to occur. Therefore, people who would be out of their houses are now having to work out of their rooms. They are in a claustrophobic kind of a situation. And when you're thrown together, even if you are with a loved one for too long, I think it produces stress. So anxiety, A, of the disease itself, B, perhaps because of the effect that the work may be affected and you may be losing your salary, you may be losing your job, or all those fears combined with the stress of being together all the time. This is causing a huge amount of problems. There is a study which was done in Europe mainly, which showed Europe and US and South America. And it showed that 44% of people in the United States had very stressed family relationships because of being together all the time and because of all the attendant fears. A lot of people reacted by eating much more. Therefore, they started gaining weight. They weren't able to go to the gym or for their regular exercises. The third was loneliness increased, particularly in Portugal, it was as high as 51%. In France, it was 41%. In UK, 42%. In Brazil, 46%. And these are authenticated, scientifically proved cases of reported in the journals. The other thing that happened was that alcohol intake and other stimulants or antidepressant use increased. And all this is likely to have a long-term effect on the health of the individual and of the communities. So you're very, very right that this particular syndrome and the impact of the lockdown, isolation, and having to work from non-regular kind of situations is causing its attendant fears and resulting in a lot of disabilities, shall we say, at the mental level.
Thank you for sharing the statistics. That really reflects how chronic or how kind of impactful this whole pandemic. It's not only the direct impact of the virus and the health and immunity, but also the mental well-being, and the resilience will play a lot of bigger role in combating the virus for the whole mankind. That's the key takeaway for us. Thank you for sharing that. Very quickly, want to touch upon COVID is just the recent phenomenon, and it is a global pandemic. Having said that, we are in the season of smog and winter allergens and multiple other issues, festivals coming in, and with that, infectious disease is on the rise. So, with regards to respiratory disorders, would you have some advice for our customers how to take care of their respiratory health and manage their health? In terms of asthma, any kind of sinuses. People say sinuses are bad. I mean, what's your take on that? Polyps that happen. What's your general take on these things and advice for our viewers?
See, people say I've got sinus. Of course, you got to have a sinus. Sinus are normal cavities in the skull and in the face. If you didn't have sinus, then there's a problem. The problem, what they actually are referring to, is sinusitis. And sinusitis is of two types. One is allergic in nature, and the other is infective in nature. When it is infective, it needs antibiotics. When it is allergic, it needs anti-allergics. But the perception is that you have sinus means it's something bad. That's not true. Every human being has sinuses. The other part that I'd like to just focus on are allergies at this time. You know, there was a time when I was a young doctor, we had far less allergies. And now we see far more. Partly it is because of the pollution, partly it is because of the artificial materials that are being used. I don't know what is the cause, but I've seen over the last 5 decades that a number of allergies have gone up significantly. If you are allergic to dust, you are allergic to pollutants, you are which are there in the environment, or you're allergic to pollens, then you need to be particularly careful during this time. For example, in Delhi, you must have read, or in UP and adjoining parts in the NCR, even Supreme Court has taken cognizance of the effects of smog and pollution.
Yeah.
It would be wise if you were to remain indoor, particularly if you are an elderly individual who's got lung disease like asthma you mentioned, or you've got a chronic obstructive lung disease, or you've got a heart disease. And particularly if you want to go for a walk even in your garden, don't do it early morning or late evening. Better do it when the sun is out. The second thing is use air purifiers. Some of them even have anti-pollen properties in it. I don't know whether they're proven or not, but the fact is a purifier will definitely be an advantage. The third thing is don't delay going to a doctor in case you are feeling breathless or any such thing. There is a common misconception amongst people in wanting not to take a medicine which is in the form of other than a tablet or a syrup. So if you take an inhaler...
Right, I mean, that's a typical behavior or thought process. Correct.
And that makes no sense. For the simple reason that an inhaler or a nasal spray is giving you targeted medication at a lower dose exactly where you need it. Whereas you don't mind taking a pill which may also produce effects on other organs where it's not needed. So that's the other point I would like to emphasize. And there are certain medications which are good to take for those who are allergic, particularly those who have seasonal allergies, to start taking a medication which prevents allergy or to reduces the effect of that allergy. And those medicines are available, and these should be taken regularly as advised by your doctor. Just a tablet there is kid tablets, 4 milligram, 5 milligram, and 10 milligram strength available. This drug is called Montelukast, and this is to prevent or to reduce the amount of symptoms that you're going to get. This should be started by people who have seasonal allergies. So I think taking care of the general basics of hygiene in your home, respiratory hygiene in your home, would require the use of these things. Last but not the least, I think a mask, which you are having to use for COVID, is a very useful tool even against pollutants. It filters out a lot of pollutants, particularly the N95 mask, and therefore there's no harm at all if you can use it for dual purposes.
Great. Thank you very much, Dr. Puri. And we are getting lots and lots of questions in the live chat. So we'll just go and go through the questions, and I'll share some of those live questions for you, and you can help us with your insights. Well, we have one question where few viewers are asking, are the younger children, especially less than 5 years of age, more vulnerable? And should children be allowed to resume schools?
Should children be allowed?
to resume schools?
Right.
Schools are, kind of digitally delivering the content?
Yeah. So, Priya, that's a good question. No, the point is, luckily, this disease does not seem to cause that much damage to children. Children may be carrying the virus, but the severity of the virus in children below the age of 12 years is rare. So it's only after the age of 12 years that they start behaving a little bit like young adults. But at the age of 5, there is no fear that you will be suffering from a major problem of COVID, which may require hospitalization. However, going to school is, this is my personal opinion. I don't think we have reached a stage where schools should be open, at least in the part of the world that I am living in, for the simple reason that the children tend to carry this, become asymptomatic carriers, and when they go home from school, they will be infecting their parents, grandparents, etc. So there is a huge danger of that. And whenever you are in a congregation, it's very difficult in school to follow that do gaz ki duri that the Prime Minister is talking about and that the scientists are talking about, and that I totally endorse. So you need that 6-foot distance. And it's difficult in school to do that. And even if you were to have this, I'm going to have a distribution which is here and there, children being children, they will meet. And it's very possible that the transmission may occur. And if you happen to have the bad luck of being a super spreader, then the entire community will suffer. So at the present moment, I think it's better to be on the side of sticking to classes from home.
Caution. I mean, better to err on the side of caution rather than, yeah. So the second question is, are we currently experiencing second wave of COVID in India? And we've heard about the numbers in Delhi and some other parts of the country. So what should we do about it?
Yeah, so Priya, you can say second wave, third wave, whatever. The fact of the matter is that like the tides of the sea, this particular disease ebbs and flows. And the ebb and flow, whatever we are seeing in the world, seems to be related to what is your personal involvement in maintaining those 3 things that we are talking about repeatedly: masking, social distancing, and hand washing. So what we saw in Europe, as soon as they opened up the pubs and the bars and the clubs and the shops, and as soon as the public transport opened up, young people started congregating in these places. And the wave that you're seeing in France, Germany, and the rest of Europe, which has resulted in lockdown again, is primarily emanating from here. And the same thing is happening in India too, because as soon as festivals occurred in, let's say, Kerala, which was having far less number of cases, there was a spike. So yeah. I think it brings us back to our own social responsibilities as individuals.
Sure. So, couple of questions from few viewers where they're checking whether comorbidities, if people are having comorbidities, how do we deal with those, people having COVID, tested COVID positive? Second of all, is COVID a singular, kind of a disease where it affects only the lungs or maybe the upper respiratory tract? Or it's a syndrome? Because many viewers are also saying that, a couple of them were COVID positive, recovered, but now they're experiencing some after effects like fatigue and a couple of other kind of symptoms as well. So how do we, both of these, are they interconnected, or what's your advice on that?
So as I mentioned earlier, COVID is spread primarily by respiratory tract, but it is not affecting many organs. The number one organ that it affects after the lungs, which take the brunt of the complications, is the heart. The second after that would be musculoskeletal system, that is your muscles, your joints, etc., and the nervous system. And the third important part is, of course, the effect that it may have on blood vessels anywhere. because now we understand that this virus attaches itself to a particular type of receptor which is present in all these organs. So any of these organs can get affected, and it's not uncommon for COVID patients to continue to have certain symptoms, particularly relating to either the muscles or the lungs. So breathlessness may last much longer in certain individuals or may recur in certain situations. And this myalgia, that is the painful muscles or a degree of fatigue, may last for sometimes months. So these are all part and parcel of the same COVID infection and need to be tackled from the perspective that majority will disappear. But complications such as those which affect the heart, like slow heartbeats, etc., or those which affect the brain or the nerves, they need to be attended to somewhat urgently. And the rest of the symptoms like fatigue, etc., will, in most cases, just disappear over a period of time. They sometimes take longer.
Sure. So we've lots and lots of very, very interesting questions. So I'll ask the last one, and then possibly we can move forward. So there is a question around what's the change in protocol from a clinical case management and handling a particular COVID patient. What is a clinical protocol? Has it undergone change? And second of all, some doctors are prescribing Fabiflu and a couple of other remdesivir and those kind of drugs. So what's your advice on that? I mean, what's your take on change in protocols? Has it rapidly changed? Because we've seen last 6 to 8 months, things are rapidly evolving on ground. Newer drugs, newer protocols.
Yes. Luckily, what we have are protocols that are approved by ICMR, that is the Indian Council for Medical Research, and they continue to be updating all the medical people about the latest that is happening. And secondly, the literature, particularly the literature that is based on science and not just on hearsay, has guided us to what is the current advisable treatment schedule in different phases of COVID. So let's say if you're in the first 4 or 5 days where the symptoms are only mild, that is, you have a little body ache, you have a little cold, a little bit of a sore throat, all that is required is gargling, it requires steam, and it requires vitamins. There is a huge role of zinc and vitamin C in this duration. Some people are using what, as you said, an antiviral agent, that is favipiravir, which is unknown, which is available in different names. But there's no scientific proof as yet that it actually kills the virus. So it's a bit of something in the air that you may take, may not take. Then if you reach the hospital, the treatment schedule has changed drastically. And earlier, we were experimenting with a lot of things, but now it's more or less standardized. The most important drug that is required is steroid. The dose and the type of steroid may vary from one hospital to the other, but it is the most effective drug for COVID in those situations where the patient is admitted and is deteriorating. The second drug that is used is what we call low molecular weight heparin. That is an anticoagulant, because we are finding that clots form not just in lungs, hearts, in all blood vessels. And these are microclots. They tend to create most of the symptoms of COVID, and the complications that occur in the lungs are due to that. So we now have oxygen therapy, which is the most commonly used is the high flow nasal oxygen. And we don't try to ventilate the patient as far as possible, because that has its own risks unless we are in a dire strait and the patient can't breathe at all. So high flow nasal oxygen, steroid, low molecular weight heparin, and in some cases, there may be a role for remdesivir in early stages and plasma in early stages in those patients who are not producing enough antibodies. But the trials do not give too much of importance to remdesivir. It does not kill the virus. It does not reduce the mortality. All it does is that it reduces the number of days the patient has to spend in the hospital. There are other drugs also which are being used, interferons and certain immune modulators, immune strengtheners, which have been used, but they are experimental as of now. At the present moment, the entire treatment schedule is based on that. In most of the cases, when you are at home with COVID, you require just paracetamol or mefenamic acid. That is all that you require as a treatment for your body ache, fever, etc. And plenty of fluids and zinc, vitamin C, vitamin D. There is a definite role. If you are vitamin D deficient, you need to make it up. And I think there are certain studies which are indicating that even vitamin B1 may be useful. So taking vitamin C, zinc, and all these deficient state patients taking vitamin D3 are important for the management. And
Great.
once you're in the hospital, just leave it to the specialist. He will manage you.
Great, great. So, Dr. Puri, I mean, I can't express how thankful we are and our viewers are with the kind of information and very, very insightful analysis, thought process, and take around the whole COVID management as well as respiratory disease management, the insights that you've shared. This will come very handy for all of our viewers and people who are watching it to really fight the virus and generally take care of their health and well-being. And we know how active and how forthcoming you are in fighting the current war against the virus. And the advice that we've taken today will just help us make it more, kind of accessible, available, and validated information is extremely important in today's, age and time where WhatsApp messages and online digital handles, there's so much of information going on, some of which is validated, some of which is hearsay, and it can really harm the public at large. So key takeaways, Dr. Puri, are that we got to really take care and take responsibility for our own health. It's one thing that vaccine may get developed, it may come to India, it may have its own time and, efficacy and how it gets administered and all of those things. But having said that, prevention is always better than cure. And we got to really be very, very vigilant. And we got to really be responsible towards our own health as well as people around us. And hence, as you rightly mentioned, the new vaccine is the mask. So mask is the new vaccine and we got to really promote it, wear it ourselves and help other people also to take care of their own health and well-being. And when there are situations of symptoms being developed, what are the kind of treatment protocols, what are the testing that are there, how do we really reach out to the doctor, when do we reach out to the doctor, when do we conduct a test, and what are the general health and well-being protocols like increase the zinc intake, the vitamins, it's a vitamin C, so to say, or B12 for that matter. So this is a very, very insightful advice, and we're very grateful for this sharing and for your time. Now, having kind of talked to Dr. Puri, at ManipalCigna, we've really taken it upon ourselves to spread the word and really make people aware that how important it is to wear a mask. So on that note, we know that you're so passionate. We would like our viewers to also be the beacon and evangelists to spread this positive message to the whole country, and not only the country, the whole world, and join our Mask Zaruri Hai campaign, the campaign that was kind of created for fighting the battle against coronavirus and keeping healthy, and kind of inspired by Dr. Puri himself, because that's a brainchild and that's some topic that he's been really talking on different forums in various kind of conversations and industry talks. So on that note, we would urge all of you to join the Mask Zaruri Hai campaign of ManipalCigna and help us join this army of getting the nation to the next level of resilience and the thought process of preventing the virus, is what I would say. So thank you, everyone. Dr. Puri, very, very grateful. And we hope that we, along with you and you yourself, are extremely successful in spreading the message, being responsible, and enabling people to really take charge of their health and well-being. After all, health hai, to life hai, as we all say at ManipalCigna. And on that note, I thank you, sir, for all the time and effort and good advice. We are inundatedly grateful on behalf of the ManipalCigna family. And I also thank all our viewers for their time, patience, and such wonderful questions ahead of the webinar and also during the webinar. Thank you very much, and stay safe, stay healthy, do take care of your health. Thank you.
Thank you.